this is a high time to say what many of my listeners have maybe already concluded from my lectures by themselves, that there are two types of people. The first because it's much more numerous, 75 to 90% of the population, these are people with a rigid psyche, over invested external self-esteem. And there is a second type of people with high anxiety, emotional intelligence, and flexible psyche. The systemic promotion of the type 1 personality style, the systemic promotion which we see everywhere, so overspread since half a century at least, has contributed to a true flourishing of a culture that idealizes the lack of self-criticism, naivety, and childishness of life attitudes, as well as the bloated theatrical external self-esteem, selfishness, trivialization, and brutalization of interpersonal and social relations. For obvious reason, this had to lead to the collapse of the culture of self-improvement and harmonious interpersonal communication. This collapse caused a pandemic of anxiety and depressive disorders in the people who adopted the current psychotic model of mental functioning, although they are actually not psychotic. Let's call their psychosis as apparent or phenomenological psychosis. The people with the primary psychosis, as I already said many times, are immune to the risk of developing anxiety and depressive disorders. That doesn't mean they are totally anxiety-free. Of course, it is also in them, but it's covered by the mechanism of the primary psychosis, just as the anxiety of the non-psychotic people is covered through the mechanisms of the achieved anxiety emotional intelligence. Both the mechanisms of the primary psychosis and the anxiety emotional intelligence may be insufficient to neutralize the anxiety, especially in the case of overexposure, which we deal in the anxiety emotional crisis situations with. This is when the psychosis gets exacerbated in the people with the actual primary psychosis, and the anxiety or depressive disorder occur in the people with apparent phenomenological psychosis, the same as by the non-psychotic people. An interesting conclusion arises at this point regarding the treatment of anxiety and depressive disorders. As I said it before many times, these disorders do not occur in the people with the primary psychosis. If they are diagnosed in such persons, it's actually only the result of the exacerbation of underlying psychosis, which can be misdiagnosed by an inexperienced primary care physician as an anxiety or depressive disorder. And in the psychiatry, unfortunately, the diagnosis sticks to the patient once it's made, and other doctors, even with considerable experience, do not dare to question it. At this point, however, it's about something else. Namely, that the observation that the anxiety and depressive disorders do not affect people with the primary psychosis should have enormous consequences for the therapeutic possibilities of these disorders where they do happen. Thus, a very effective method of therapy of the people suffering from the chronic anxiety and depressive disorders, the chronicity being the typical feature, will be for these people, a very effective method of therapy will be the induction of the primary psychosis. Such induction can be achieved both pharmacologically and psychotherapeutically. Moreover, the pharmacological method unknowingly has been in use for several decades now. Because what, if not the induction of the primary psychosis, is the use of drugs from the group of benzodiazepines or even neuroleptics in the anxiety and depressive disorders? The effect of these drugs is an induced psychotic state, which, just like the natural primary psychosis, blocks the excess of anxiety stimuli to the human consciousness. They also stiffen the psyche and impair the function of the self-critical apparatus. Every psychotherapy of the anxiety and depressive disorder should aim at the same thing. That's the inhibition of the function of the self-critical apparatus, the reduction of the logical and emotional functions, and the increase of the theatrical external self-esteem. Thus, the intention is to help shift the consciousness of the suffering person to the psychotic path of the primary psychosis. Therefore, two humanities live side by side. The type 1 humanity, psychotic humanity, the children up to the adolescence, and those adults who did not recover from the primary psychosis and thus live in the primary psychosis, as well as the people who did recover from the primary psychosis but consciously imitate the attitude of the primary psychosis for the reasons of the culture. And the type 2 humanity, that is, those of us who have transcended the primary psychosis in the adolescence or later and are more or less strong with their anxiety, emotional intelligence, and try to face the challenge of the anxiety and emotions with their anxiety, emotional intelligence. 2. How different humanities. In fact, it can be said that throughout the history of the human species, the type 1 humanity has invariably dominated the type 2 humanity. Hence, the everlasting fashion for the first of these two psychological types. Starting with the earliest years of the childhood already, those children in whom the features of the primary psychosis are the most expressed dominate over their group. So, extreme irresponsibility and unpredictability, no self-criticism, and of course, the gigantic, theatrical, external self-esteem, identical to the Freudian concept of the ego. This is a good time to tell you that the primary psychosis appears in the whole gradation of the severity, from the weakest through more and more intense to the extremely strong. And it is the latter that guarantees the dominance over the peers and the greatest attractiveness in their eyes already in the childhood. In other words, children are the most impressed by their friends with the primary psychosis in the extreme severity, and this despite the fact that some of the children presenting such an extreme severity of psychosis have considerable conflicts with their children and with their caregivers. The evocative theatricality of the people with external self-esteem makes them strive to be always in the center of attention at all costs, including the price of breaking the rules of social conduct. And being the center of attention has something magical about it for the simplest reason. It attracts attention. And this attention can be used in various ways. The goal is to win the sympathy of all observers. And this is what the external self-esteem theater is about. It's about seducing and enchanting the environment. Thank you.